I'm doing my project on the Ebola virus. The Ebola virus is caused by acute arterial illness, which is often fatal if untreated. The EVD first appeared in 1976 in two simultaneous outbreaks, one in what is now Nigeria, South Sudan, and the other in Yabuka. The latter occurred in a village near the Ebola River, from which the disease has taken its name. The 2014 to 2016 outbreak in West Africa was the largest Ebola outbreak since the virus was first discovered in 1976. The outbreak started in New Guinea and now moved across the land bordered on Syria, Liberia, and currently in 2018-2019, the outbreak in eastern DRC is highly complex, with when insecurities adversely affecting the public health response activities. The virus family Floridae includes three genera: Curavirus, Marburg virus, and Ebola virus. Within the gene Ebola virus, 6 species have been identified: Zaire, Bungalola, Sudan, Tia Forest, Residon, and Babel. The virus causing the current outbreak in the DRS and the 2014-2016 West African outbreak belong to the Zaire Ebola virus species. The way it's transmitted: it is transmitted through fruit bats that Prefidel family are natural Ebola virus hosts. Ebola is introduced into the human population through close contact and blood, segregations, and organs and other bodily fluids of infected animals such as fruit bats, chimpanzees, gorillas, monkeys, forest antelopes, and porcupines found ill or dead in the rainforest. Ebola then spreads through the human-to-human transmission via direct contact through the broken skin or muscular membranes with blood or body fluids of a person who is sick with it and dies from Ebola. Objects have been contaminated with bodily fluids like blood, feces, vomit from a person sick with Ebola, or a body of a person who's died from Ebola. Healthcare workers have frequently been infected while treating patients with suspected confirmed EVD. This occurs through close contacts with patients when infection control precautions are not strictly practiced. Burial cemeteries that involve direct contact with the body of the deceased can also contact the transmission of the Ebola. People remain infectious as long as their blood contains the virus. Pregnant women who get acute Ebola and recover from the disease may still carry the virus in breast milk or pregnancy-related fluids as in tissues. This poses a risk of transmission to the baby, then carried to others. Women who become pregnant after surviving Ebola disease are not at risk of carrying the virus. If breastfeeding women who are recovering from Ebola wishes to continue breastfeeding, she would be supported to do so. Her breast milk needs to be tested for Ebola before she can start breastfeeding. And there's several symptoms of Ebola. The incubation period, that is the time interval from infection from the virus to onset of symptoms, from 2 to 21 days. A person infected with Ebola cannot spread the disease until they develop the symptoms. Symptoms of EVD can be sudden and include fever, fatigue, muscle pain, headaches, sore throat. This is followed by vomiting, diarrhea, rash, symptoms of impaired kidneys or liver function. In some cases, both internal and external bleeding, for example, oozing from the gums or blood in the stool. Laboratory findings include that low white blood cell count and platelets count as elevated liver enzymes. How can you diagnose this illness? It can be difficult to clinically diagnose EVD in other infectious disease such as malaria or typhoid fever or meningitis. Many symptoms of pregnancy and Ebola disease are quite similar because it takes the pregnant women should ideally be tested rapidly if Ebola is suspected. Confirm that the symptoms are caused by Ebola virus infection are made using the following diagnosis methods. An antibody captured enzymes linked to immunosorbent assay. ELISA is one of them. Anti-captured detection test, serum and neutralization test, reverse Trampolin's polyamine chain reaction, electron microscope, virus isolated test cell cultures. Careful consideration should be given to the selection of diagnostic tests, which take into account technical specifications, disease indicated and prevalence, and social and medical implication test results. It is strongly recommended that diagnosed tests which have undergone an independent and international evaluation to be considered used. The current WHO recommends what it's depending on what physician you ask. The infectious disease doctors automated semi-automated nucleic acid test for the routine diagnosis management. Rapid antigen detection test is used for the remote setting, and the NATs are not readily available. These tests are recommended for the screening purpose as part of a surveillance activity. However, reactive tests should be confirmed with NATs. The treatment for the Ebola: support care, rehydration, and oral intravenous fluids, and treatment of specific symptoms improves survival. There is yet no proven treatment available for EVD. However, a range of potential treatment, including blood products, immune therapies, and drug therapies, are currently being evaluated. In the ongoing 2018-2019 Ebola outbreak in DRC are the first ever multi-drug randomized control trial. It's being conducted and evaluated, and the effectiveness and safety of drugs used in treatment of the Ebola patients under the ethical framework developed in the consultation with the experts in the field of DRC. Vaccines. An experimental Ebola vaccine is proven highly protective against the EVD in a major trial in Guinea in 2015. The vaccine, called RVSV-ZBDOV, is studied in a trial movement. Among the 5,837 people who received this vaccine, no Ebola cases were recorded 10 days or more after the vaccine. In comparison, we are 23 cases in 10 days and more after the vaccine is among of those who did not receive the vaccine. The RSVS vaccine is being used in the ongoing 2018-2019 Ebola outbreak in DRC. Pregnant and breastfeeding women should have access to this vaccine under the same conditions of the general population. How to prevent this horrible disease? Good outbreak control relies on applying a packaging intervention, including case management, surveillance, contact tracing, good laboratory services, safe burial, and social mobilization. Community engagement is key to successful controlling outbreaks. Raising awareness of the risk factor for Ebola infection and protective measures include vaccination that individual can take in effective way to reduce human transmission. Risk reduction message should focus on several factors: reducing the risk of wildlife human contact, reducing the risk of the human transmission, outbreak containment measurements, reducing the risk of possible sexual transmitted, reduce the risk of transmission from pregnancy related fluids from the tissue,